Hello, everyone. My name is Dr. Rajachandran. I am one of the interventional cardiologists here at UMC, and I'm here to talk to you about National Heart Month, which is the month of February, which has been designated as the Heart Awareness Month for the United States. This is a very important issue that the American Heart Association and the NIH are trying to emphasize and bring to light, so that folks understand the scope and nature of heart disease. It's very important for your heart health and for your general health.
It is February, American Heart Month. Can you tell us about this national event and purpose?
Well, the American Heart Month is a yearly annual awareness month created by the National Heart, Lung, and Blood Institute and the NIH to increase awareness of heart health in the United States.
What heart-to-heart awareness is important in this fight against heart disease?
So folks need to understand that heart disease is an eminently treatable condition, and there are many lifestyle modifications that one can make to alter their risk and reduce their risk. Among them is regular exercise, 30 minutes a day, maybe 5 to 7 days a week, aerobic exercise, eating right, eating healthy, keeping your sugar intake down, keeping your fat intake down, reducing stress, avoiding bad habits like smoking or being around secondhand smoke, and generally increasing your activity levels so that you're actually burning off calories and reducing and keeping your weight at a recommended level.
What are the most common differences in symptoms of a heart attack in men and women?
Heart attacks in men are usually much more classic in presentation than in women. Men usually have the classic symptoms of chest pain, shortness of breath, an acute feeling of anxiety, and a sense of impending doom. Women, on the other hand, can have very subtle presentations and very, very subtle symptomatology. They often may not have chest pain. They may have just indigestion or shortness of breath, or just a generalized feeling that they're not doing well, a feeling of what we call malaise in the medical profession. All of these signs can be warning signs of an impending heart attack. And what we at Texas Tech urge folks to do is to get to an ER immediately so that they can be evaluated and treated appropriately.
What kind of awareness do we need knowing we are in a pandemic?
The pandemic has created a special situation for all of us in the last year and a half, and it promises to be a problem for us in 2021 as well. I insisted on wearing a mask during this presentation to convey the importance of mask wearing in basic prevention and in basic health in terms of protecting oneself from the virus and one's loved ones. I think that folks need to understand that this virus is a fairly virulent organism and can cause significant heart problems, as well as the more well-known lung problems that people see on the news that this virus does cause.
What should our community know?
Even though we're in the pandemic, and even though this is a special situation for all of us, and we're all scared, and we're all especially scared of hospitals and coming into the hospital, we urge everyone who has any symptoms suggestive of heart problem, chest pain, shortness of breath, a generalized feeling of feeling bad or malaise, to come to the ER to be checked out. Do not be afraid of the virus. We are well protected here in the hospital, and patients who come into the ER and to the hospital are also very well protected by our nursing staff and by our physician staff.